Hello, my dear audience, and welcome to another episode of Let's Talk Micro. As always, I hope you had a great week. And if you have been listening for a while, you know that normally I do like a little preview and I talk about the previous episode, but today we're doing things a little bit different. So if you are tuning in because you want to hear more about the checklist, let's go ahead and jump right into it. If you're listening, your lab is probably accredited by the College of American Pathologists, and maybe you know about the checklist. So this episode is about the latest updates to the microbiology checklist. And the updates are about nomenclature and media. And if you work in a lab, and you know that sometimes that's a struggle when you have different instruments and you do different testing and you're getting all these different names. And when you're doing quality control, you have some media that requires, some organisms to be plated on it, and some maybe just something like sterility. So in this episode, I am joined by Dr. Christi Wojewoda, and she comes to the podcast to talk about these changes. So let's go ahead and listen to it, and stay tuned. At the end, I have a very important announcement. Well, if you work in a lab, and in this episode we're focusing on microbiology, but if you work in a lab and your lab is actually accredited by CAP, the College of American Pathologists, you're very familiar with the process for making sure, right, that everything is okay. You hear about the checklist, and maybe you're not too familiar with them working maybe at the bench level, but maybe if you're like a lead and are more involved in management, and so at least some way or another in the lab, if you get inspected by CAP, right, you're aware of what they do to some extent. So I thought today will be a good time to talk about some checklists in microbiology. And with me today, I have Dr. Christina Wojewoda. And if the name sounds familiar, she was a guest before when she shared the horror story that their lab went through when their system, their network went down. So, Dr. Wojewoda, welcome again to Let's Talk Micro.
Excellent. Thank you.
Definitely a pleasure having you here. So it has been a while since you've been a guest here. So maybe for the audience, if you can start with a quick intro about what you do and anything else that you want to share.
Yeah, of course. So I'm Christi Wojewoda. I'm the director of the Clinical Microbiology Lab at the University of Vermont Medical Center, and I'm vice chair for education and professor in the Department of Pathology at the Larner College of Medicine at the University of Vermont. I've been involved with the CAP for a very long time. Most recently, I rolled off as chair of the microbiology committee. And that's the committee that sends out proficiency testing samples and helps give input to the checklists. So I rolled off of that at the end of December, and I'm currently on the Clinical Pathology Education Committee for the CAP.
Okay, well, definitely welcome back. So I thought it will be good to start like we do here on Let's Talk Micro, start with some basics, and we hear the checklist, and maybe someone that's just right now maybe going through like a lab program or getting started in the lab, they're not too familiar with this. So maybe you can start with what are the CAP checklists?
Great question. So the CAP checklists are basically requirements that the labs need to follow to either become and or stay CAP accredited. Um, the basic level, they have to cover what's required in the Code of Federal Regulations governed by CMS, or you might hear the term CLIA. But the CAP checklists often go beyond what's just required in CLIA to incorporate new or emerging technologies, best practices, just updates in lab safety, those kinds of things. They're reviewed and updated annually, and so that's why they can be a little bit more nimble than the Code of Federal Regulations. And the reason I like CAP checklists is that they're developed with input from pathologists and lab experts, and they're broken down into chunks. So, like microbiology has its own checklist. So, I don't need to flip through all the surgical pathology stuff to figure out what I need to do in my lab. And I see them as a roadmap to ensure that my lab is performing at the highest level of quality that it can be. And I encourage my lab staff to review the checklist and to help get involved, making sure that we are um, meeting all of the requirements in the CAP checklist. Because when you're required to, do this much QC or do this documentation or do this safety thing, if you don't understand the why behind it, it's just another thing you have to do, and you won't put as much emphasis on it. So I encourage you, if you work in a lab, ask to see those checklists and understand the why behind what you're doing.
I love that you said that. That's something really big with the way that I have thought over the years and working in the lab. And not everyone thinks that way. And I think I sometimes you experience some roadblocks, but I truly agree with that statement that, especially, understanding the why of what you're doing things. So I second what you're saying, and definitely I exhort the if you work in the lab, get familiar with them. There are some updates to the microbiology checklist. So let's start with the MIC.11038, and this one is regarding media. So what are the updates?
Yeah, so the requirement was updated, and the old requirement said that you could perform an IQCP, or individualized quality control plan, for exempt media. But for non-exempt media, you had to perform end user QC, so QC in your lab for each new lot or shipment, with the organisms that were recommended in the package insert. Now, there is no designation of exempt or non-exempt anymore, and you can perform an IQCP to define the appropriate quality control practices for both exempt, non-exempt, or what used to be known as exempt or non-exempt.
Yes, and if you work in microbiology, maybe as you're listening to this, you're understanding. Okay, that's why when we get some media, some we go ahead and do the QC bugs, and then we don't do it with all of them. So the question is, so why this changes or updates?
Yeah. So the real reason is the document that defined exempt versus non-exempt, which was the CLSI M22 document. Um, CLSI decided not to keep that document live anymore. It was archived. So there is no longer that guideline to define what media requires more QC and what media does not require as much QC. Additionally, CMS no longer recognizes the category of exempt and non-exempt media for the purposes of QC. And CMS says that labs can develop an IQCP or follow the media quality assurance as written in that package insert. So because those categories went away, CAP was able to pull that out of the checklist.
Okay, and to kind of go to what you were saying about the knowing the why and things like that, and as you have talked about, so do you know maybe why some media were designated as exempt and some non-exempt? What was the I guess the criteria used for that?
Um, so I actually did a deep dive into this today because I wasn't really sure, and I was like, what, we just always had exempt and non-exempt. What does that even mean? And like in my head, I knew exempt was kind of like your blood auger plates, your plates that are hardy and they never fail you, and they're not designed to pull out something special or fastidious. And exempt, usually were more special and grew something. They were either selective or they grew an organism that was more fastidious. But I was able to pull up the old M22 CLSI document. It was initially published in 1990. The most recent edition was 2004, so over 20 years ago. And that document used data from a CAP survey. So CAP sent out a survey to microbiology labs asking about failure rates of commonly used microbiology media. And based on that data from it started in like 1984, I think, through 2004. Some media types were proven to be more reliable, and performing QC in your laboratory that the manufacturer already performed wasn't necessary. But then, and those media that performed reliably, didn't have a high failure rate, they deemed as exempt. And the actual definition in the M22 document defines exempt media as commercial media that was documented to maintain consistent user performance with minimum variation and requires minimum quality control. Basically, you can rely on the manufacturer's QC. But based on that same data, again, most recently performed in 2001, other media types that had a higher failure rate were deemed non-exempt. And the M22 advised that for that non-exempt media, they required complete user quality control, including satisfactory performance with recommended organisms. So this was old data based on probably old manufacturing practices. And now manufacturers are performing QC. And so if you perform an individualized quality control plan, you do the risk assessment, you see that what used to be known as non-exempt media does not have a high failure rate, that it always performed appropriately, you can determine the frequency of QC or what you can rely on for QC in your laboratory for that non-exempt media now.
Well, thank you for that. And yeah, a lot of this non-accept media, and I play a big part in doing the QC in my lab, and they do perform really well. Like they are so consistent, and some of them, they do require a lot of organisms to put in, and but they do, so it can be, especially in a high volume facilities. Like here we go, we run through the media, and the next thing you know, you get through that, and you're getting the next shipment and or the new lot, and you're going through that again, and overall, been doing it for like 3 years, and they perform really well. So yeah, so it's kind of, this is one thing that we're seeing now, like some when it comes to some changes about here in media. I was doing an episode about susceptibilities where the frequency of the QC also for, so there's some changes coming, and I have to say, I like them.
Again, CAP is trying to make things easier for labs and have the requirements be logical. If our systems have become more reliable, if our media manufacturers have become more reliable, we don't want to put extra pressure on laboratories. That doesn't make any sense.
Yeah, I completely agree. Yeah, just before I jump to the next question. When I was doing the episode about the CLSI and the newest update, yeah, that whole thing about susceptibilities for, QC for susceptibilities, that weekly QC, that's like a whole day event pretty much, with all the tests that we have and all the things that we have to do. And on top of that, you add the ones that you have to perform it, every day. So there's a lot of QC going on. Okay. So then this one also, there's let's talk about the MIC dot 11375. So this is about nomenclature, right? So what are the updates, or what is the MIC 11375?
Yeah. So the old checklist item used to say that you needed to review any taxonomy and nomenclature updates and implement those updates within your laboratory. That was fine and dandy when one organism changed its name in a year, and it could have treatment implications. So the old example was when Bronhamella went to Moraxella. Like that was probably before you and I were born. And so you should have a working knowledge of when things change. The problem is with all of the research that's going on now, especially with different sequencing methodologies, um, there the taxonomy and nomenclature for organisms is changing very quickly. Um, and for some organism groups, specifically bacteriology, mycology, there isn't one name that is recognized as the truth. You can validly publish a new name for the same organism, and both of them can be correct. And so, because of this confusion, and because we know that manufacturers are updating databases without even telling laboratories that it's happening, it was putting a lot of pressure on labs to do a lot of research into what does their database say and which name do I need to use for these organisms. And so um, we pulled back and we said, okay, you know what? The basic level is if you're reporting one organism by different methodologies, you're reporting it by the same name. So if you have a rapid blood culture ID and a biochemical ID system, make sure that you're reporting the name the same way so that the clinician doesn't think that the patient may have two different organisms when it's really just the same thing. So it's confusing for clinicians, it's confusing for microbiologists. There is no truth in the world of, again, bacteriology, mycobacteriology. If you ask the parasitologist, there is truth. They have much better rules in parasitology than the bacteriologists, mycobacteriologists do. Mycologists are kind of in between. They've got a consensus working group going on, but we're still figuring out the best way to determine appropriate taxonomy and nomenclature, especially for the clinical world.
Yeah, I can see, and yeah, this is something that we experience in the lab. Like, for example, you're setting up some moldy stuff, and then all of a sudden your ID comes back as Shalii odontolyticus, and you're like, what? And then it's like, oh, okay, yes, it was known as Actinomyces odontolyticus, and then you're like, okay, and then yeah, you get all this, and as you mentioned, with the manufacturers and things, you're getting all these names, and then it can cause some confusion, and I know that maybe if we can expand a little more on that, because I know that I was reading that article that was published in the Cap Today periodical, and it was saying like there isn't necessarily one true name, right? Maybe you can just talk a little bit more about that.
Yeah. So I've learned a lot about this more than I've wanted to um, in the past few years. So again, parasitologists, they have a very good set of rules. And so before a new name is published, it's been vetted and the old name changes to the new name and we move on. But for, again, bacteria, mycobacteria, there's rules to publish a new name, but those rules don't regulate which name is correct for the same organism. So you can call it Shalii and I can call it actino, and we're both right. And so that's super confusing, especially for the clinical teams. Um, Maybe 5 years ago, all of the mycobacteria changed their names, and then people were like, "Nah, we don't like these," and they kind of pulled it back. And so it's really confusing for both laboratories and the clinical teams. Um, Really, I think people have spoken up that it can have a really large clinical impact if the providers reading those results don't understand what that organism is or how to treat it, because they don't recognize the name.
Okay, and speaking of, we have mentioned IQCP, and so is there a template for this? I know like there's a mention of like a CLSI ASM template. Maybe you can talk more about that.
Yeah, so this template was developed collaboratively between CAP, CLSI, and ASM. And it was recently updated to include the new changes to the media categories. So if you're a CAP accredited lab, it can be found in eLab Solutions, along with some updated IQCP FAQs and some resource documents. If you are not CAP accredited or you don't have access to that eLab Solutions login, you can just Google ASM IQCP, and I found it that way also.
So, and then regarding the nomenclature changes, so if do you have any advice to offer? Maybe if so to keep this consistency on the names, what can labs do?
Yeah, so the easiest thing to do is to take a look at your databases and reporting options of your different systems and make sure that you're reporting the same organism the same way. We also went through our MALDI database with the latest update, and we showed the new names to our infectious disease practice committee, which is ID, stewardship, infection prevention, and pharmacy. And we worked with them to decide what new name to use. It's been in the literature enough, they understand what it means, versus they've never heard of that. Please don't change the name. And when we change names, we still put the old name in parentheses so that the clinical team has like a decoder ring that they can figure out what it used to be called.
Yeah, as you were talking about that, I was thinking because that's how I see it when I'm like in my lab when I'm resulting. It was very one day. It was just very right, very surprising when you like Candida glabrata, and then parentheses, and you see this name, and you're like, what? Going like, so it can so having both names, yeah, it definitely makes a lot of sense. So you can have okay, this name I don't know, but okay, this is known as this, and they see it. So that's a great thing. Okay. Regarding all this, is there anything else that you want to add?
The only thing I want to add is that I want to put a plug in to please provide feedback on the CAP checklists, especially if they don't make sense or they seem super onerous. When we have the experts in the room, we know what we're going for. It makes sense to us, but it might not make sense to everyone or be the right fit for every scenario or every lab. There are a lot of review steps in place. It not only it gets reviewed by multiple committees, it gets input from outside pathologists. But if you're at the bench and something just doesn't seem right, please reach out because that's how we know if a checklist item just isn't doing what it's supposed to be doing.
And they can reach out via going to the CAP website.
I think the easiest way is to call CAP or you can email accred.cap.org.
And I will go ahead and include that on the show notes so you can have it there as you're listening to this, and maybe you don't remember. So it's there for your records. But you mentioned the phone calls, and yes, they are really good with that. I remember when I used to be in charge of the surveys, and I had some questions about the results and things like that. And I'm like, okay, maybe my lab is not doing this. What's the best way to maybe proceed about reporting this, or this doesn't make sense? A quick phone call. They're always very helpful, so I can attest to that. So I got my questions answered. So I definitely, if you have a situation like that, or if you have any feedback, go ahead and call, and someone will pick up and hear what you have to say.
Yes. Um, if you subscribe to CAP proficiency testing, um, the bacteriology survey, the fungal survey, parasitology, and mycobacteriology all have write-ups that come with those results that talk about the organisms that were sent out. So they're super educational. You can get CE credit for reading them and answering some questions. But also, there's a lot of advice about best practices. How should you culture for this organism? When should you look for it? And what specimen types? A lot about susceptibility testing or intrinsic resistance. And then there is always a bit in there about nomenclature and what the latest and greatest name is for this organism and what's been accepted and what's kind of like just out there in the literature.
Yeah, okay, definitely. So check that out. And well, I have to say this has been great. And right, sometimes seems like microbiologists, we like to complicate our lives with all sorts of things. We cannot make it easy. So it's difficult when you're learning. It's difficult when you're teaching. It's that's the way it is. I mean, it's complicated. But I want to thank you for taking the time and shining a little light on this. I know that this can hope the listeners enjoy it, and especially as we get, if you're in an inspection year and you're getting ready, getting your lab ready, knowing about these things, is very important. So, Chrissy, thank you so much for taking the time to be in Let's Talk Micro.
Excellent. Thank you so much for having me again.
My pleasure. And there you have it. Those are the latest updates to the microbiology CAP checklist with Dr. Christi Wojewoda. As always, you can find Let's Talk Micro on any podcast platform like Apple Podcasts, Spotify, Amazon Music, and in social media, you can find me on Instagram, TikTok, Blue Sky Social, and YouTube as Let's Talk Micro, on X as Let's Talk Micro 1, on LinkedIn as Luis Plaza, and I have an email address which is letstalkmicro@outlook.com. So I invite you to subscribe to the podcast, download episodes, and if the app allows you to do so, please go ahead and leave a review. Thank you so much for the support, and if you want to support the podcast in any way, you can do so via a Venmo link and via Buy Me a Coffee, KOFI, both links available on the show notes. And if you're looking to learn more about antibiotics, please check out www.learnantibiotics.com and the Learn Antibiotics book available on Amazon. These resources include cheat sheets, practice tests, games, and more, and they are being used by thousands of people worldwide and may be helpful for you or your colleagues. And these are some great resources from Dr. Timothy Gauthier, a very passionate pharmacist. Okay, so it is time for the announcement, and I am so happy and so grateful for this, but I am happy to say that Let's Talk Micro It's now supported by the American Society for Microbiology. To learn more about microbes, visit asm.org. And that, my dear audience, it's the end of this episode. I hope you enjoyed learning about the microbiology CAP checklist. As always, I enjoy sharing this information with you. Thank you so much, ASM, for supporting the Let's Talk Micro podcast. You are great. You're amazing. I am so happy and grateful. We're all we want to educate, we want to share information, so I am so happy. So once again, thank you to the American Society for Microbiology. It is great. I am so happy. And please, continue bringing that passion to what you do. It is so important. You do such great work. So, as always, stay motivated, stay safe, and of course, continue talking micro. Until the next time. Bye.